Review the agenda. And also, if there's any additions, please let me know.
Madam Chair, I'm sorry.
Yep.
Lost my train of thought there for a second. We do need to move our immunization services presentation to January. Shelley is out sick today.
Thank you.
The
Noted.
respiratory illness daughter coming to work.
Well, I hope she feels better.
I hope so too.
Yeah. Any other changes or additions? Okay, then we can move into the minutes. Please take a moment to review the minutes. And I did have one addition, if I could. In our wonderful presentation from Laurel on the variance hearing, in the meeting, I suggested that we get a regular present. This makes our maybe an annual or biannual presentation with new board members coming on potentially, just because it was such a helpful presentation. So I just wanted that noted in case that would be helpful as you look back.
Absolutely.
Thank you. Any other additions or corrections? Okay, hearing none, the minutes are approved. And then we can move into our board discussion section of the agenda, which is finishing up our NALBO Board Health Effectiveness Assessment. So if you all board members would like to just kind of recall, a few meetings ago, what meeting was it?
September.
We weren't able to finish, so we decided to wait until we had a little more time to finish up. So we're discussing kind of the essential governance functions of boards of health. And this is something we do annually where we remind each other and ourselves of the different functions of the boards of health. And then we have a conversation about maybe how we've been doing and what we might want to think about building more into our conversations for this coming year. So that is the purpose. And we have the last three to go for partner engagement, continuous improvement, and oversight. So the NALBO governance functions page in our packet would be a great place to reference as we have our conversation. And the way we were structuring this for the other piece of this conversation was just to kind of check in a little bit about what we've done and try and make some examples of successes, and then think about if there's anything we've learned that we'd want to recall and then potentially call out, and then if there's any goals for the future. So when we think about partner engagement, is there anything you want to add?
No,
I got it.
you got it.
Okay.
Yeah.
And then also NALBO, just as a recollection, is the National Association of Local Boards of Health. So they're a national organization that helps all the groups like us across the country with resources and best practice strategies for doing our work. So that's where this comes from. So when we think about partner engagement, we're tasked to build and strengthen community partnerships through education, engagement, and to ensure the collaboration of all relevant stakeholders in promoting and protecting our community's health. So I just wanted to open that up if anybody had any comments or thoughts about how our Board of Health and Health Department's doing with partner engagement.
I just have one comment. I missed the last presentation, the community presentation, and I know it was on inoculations. I need you said you could stream it. I could stream it. So I need that information, number one. And number two, did the presentation encompass both sides of vaccine injury as well as vaccine, strengths?
The episode itself did cover both sides. They talked about both the efficacy of vaccines and the safety of vaccines, but that there are risks associated with vaccines. And then the discussion also, as everyone kind of shared and you kind of participated in those and kind of saw how
Yeah,
those
I
unfolded.
did.
So the conversation in the room was definitely on, both sides were brought up and both sides were discussed. Shannon, you were there if you wanted to add anything more to the last Invisible Shield episode and.
Yeah, I mean, I think that's, what Dorinda said is correct. I would say that it didn't focus so much on vaccine injury as much as vaccine hesitancy and sort of the social process of how vaccine trust or hesitancy sort of develops within like kind of a communal setting. But I would say like both sides, it wasn't as clinically focused. It was more kind of like the social aspects of vaccine messaging.
Right.
And the room was filled with the majority of public health advocates who tend to be on
Mhm.
the side of that, vaccines. So, so yeah, it was discussed, but
Okay,
Mhm.
so my only concern for the health of the community is I feel like people do not have informed consent. And most people don't know where to look for it. They aren't given it when they go in to get, I mean, they'll tell them there's risks and it'll be listed, but they don't really show examples and, things like that. I think we could do a better job of that because I feel like the public needs to be educated on both sides. So I kind of wanted to float an idea of if I put together a presentation and just showed it to the board at some point, I'm going to be gone January and February, so I can't do it. I wouldn't be able to do it until spring. And just see what you thought. And it was something that we could maybe bring to the community on a broader scale. But of course, first with your permission and viewing and that kind of thing, and very well documented and that kind of thing. None of this bluff stuff that might not have merit.
Thoughts?
So I guess are you thinking more from like the common vaccines from like a public health perspective, sort of just educating people on the risks and benefits of those on a community level? Or are you talking more like clinically when somebody goes to get the shot that like at that point they're not getting the information and
I
that
think
we could
both.
supplant that?
Both, I think it's both. And my business would not be with, the doctors. That's kind of their deal to present that kind of stuff. But I think as a community health organization that's publicly funded, I think that we owe the community both sides of the story, and it needs to be in depth so they really understand what they're taking and how vaccines have changed over the years. That's just a few things. So I just wanted to throw that out there to kind of get the thought process going, and we can certainly talk about it and decide if that would be worth it.
Thanks for bringing that.
Yeah.
Any other discussion from the board from Sherry's suggestion?
I think it's a great idea as far as, the more public education, the better, obviously. I would be interested in hearing sort of Amber's thoughts to see, I mean, because I think you get to a point where there's sort of like information overload and so how to like message that and what it would look like and who would be the target audience, I think are important questions. But as far as, pushing out additional information and public education, that's, I think, always a good idea if it's effective.
Right. And I understand vaccine hesitancy. I know that's a concern amongst the medical community, so it would have to be done very thoughtfully and very delicately. And it would just be an introduction type thing to get people's thought processes going. I'm certainly open to ideas.
I'm a little lost how we got here.
Oh,
Sorry.
it's on the
We're on that announcement?
second part of partner engagement with the broad
Oh,
cross-section
okay.
of members of the community regarding public health issues.
Gotcha. Okay.
That's where I'm coming from.
Yeah, and I noted, so I'm taking notes on the discussion related to the assessment. So I did note that the Invisible Shield was an opportunity for conversation, but then also noted that we have room for improvement with how we share vaccine information and like more to follow up on.
Sure.
So.
Okay. Thank you.
Okay, great. Partner engagement, I would say that the health department's strength is its ability to lead coalition work in general. There's many different communication tables happening, and it feels like the health department is often a thread that's able to sit at multiple tables and then kind of champion the ideas and the community kind of prioritization at these different tables and bring it into our community health needs assessment and strategic plan around it. So I think partner engagement is really important. And I will honor, what you brought is, after the pandemic, there's definitely, became apparent that there's multiple perspectives about the work that's happening at the health department. And so there's an opportunity to strategically and thoughtfully weave the dialogue of how our work impacts the entire community.
Right.
Yeah,
Mhm.
yeah, I can see that. Anything else from the table? And then we'll move to Zoom for partner engagement.
I agree with you. I think that one of the strengths of the department is partner engagement at a systemic level, particularly with other sort of organizational stakeholders. That's something I think the department does super well, in a way that I think the connection to I don't remember the presentation I went to at St. Peter's.
It was our community health improvement plan progress
Yes,
report.
the progress report. Just from that, attending that, I mean, it was so evident the amount of sort of inter-organization and interagency communication that happens that the health department stimulates. I think that's great. I think something we've heard in the past couple of meetings has been a desire to sort of do that on a more like micro level, like not necessarily at the systemic level, but sort of engaging with partners outside of the necessarily the health apparatus, but more community service providers and other arenas to sort of be more holistic in the way that we serve people in the community, individuals in the community beyond just like a systemic level. I feel like we've talked a lot about that with the WIC program and with some other programs. So at a high level, I think great job. Like the department's doing excellent work there. And it seems like maybe at the more like kind of individual level, there's maybe some more work to do, but I don't know. That's just anecdotally from what we've heard recently.
Thank you.
I would think staff shortages.
Right,
Stuff,
right,
Yeah.
of course.
Okay. Anything that any board members would like to add from Zoom, please feel free to turn on your cameras and let us know your feedback, strengths or areas of improvement on partner engagement. Okay. The next subject here is continuous improvement. So continuous improvement is a big part of public health, which is routinely evaluate, monitor, and set measurable outcomes for improving community health status and the public health agency's governing body's own ability to meet its responsibilities. So this can include assessing the health status of the community at large, supporting the culture of quality improvement within our governing body and also the public health agency, holding us all as members and the director accountable to high performance standards, and evaluating our effectiveness, and then also examining all of the structures, compensation, core functions, et cetera, and making sure that there's proper orientation for ongoing professional development for us as board members. So when we think about continuous improvement, how are we doing?
I think you guys do an amazing job, honestly. You have a lot on your plate.
Awesome.
Mhm.
Yeah, thank you. I think that the accreditation standards have really helped create a really great structure by which our health department can achieve its goals and measure the outcomes. And it's just such a nice, elegant system that's been brought in. So I would say that that's a huge piece of it. And then Drenda, I would just say that you're really a mastermind in systems improvement and thinking about how all of the different pieces line up and coordinate towards this ultimate mission and vision of the health department. So kudos for you on that. I just think, and the ability to take feedback and adapt and respond and overcome is just something you do again and again and again and your staff. So thank you
Yeah, I'm doing that consistently.
over and over.
Yep,
Yeah.
despite various challenges
Mhm.
that pop up. So
Yeah.
it is continuous, which is great.
Yeah. Mayor Collins, I see you turned on your screen. How you doing up there? Would you guys like to?
Doing well.
Great, great. And would you want to provide any sort of feedback about continuous improvement you're seeing here at the Health Department, Board of Health, or any feedback?
No, I think, I haven't seen Drenda in a long time, but no feedback, none at all. I think
Oh.
they're doing great and I appreciate working with them.
Great to know. Thank you. Okay, anything else from Zoom? Mayor Harris?
Yeah, I would just give a kind of a old football coach analogy. Say there's definitely a focus on like self scout. So there seems to be a focus on always monitoring, the processes and how we go about things on this board, and I think that's a sound policy. So I think you're doing great.
Wonderful. Thanks for the feedback. Anyone else? Do we have any goals or aims for this section? I feel like this one's a real strength of ours, but there's always rooms to improve. I would say for incoming members, how's it feeling with your orientation? Or is there any feedback you could offer as ways that we've been onboarding or anything we missed or?
There's just so much.
Yeah.
And I'm still learning.
Yeah.
And so I'm trying to walk delicately
Yeah.
because I think you guys have a lot on your plate, like I've said, and I think you do a really good job of the things that you have encompassed. Can't do everything. I know there's some shortcomings on like the restaurant, that kind of thing, because you're minus a staff member, I think, for that. Is that true?
And we're short-staffed on both the environmental health side and the licensed establishment side of our
Yeah.
operations. Mhm.
And you're waiting on more funding for that through the legislature?
Yeah, we're hoping to increase fees
Uh-huh.
so that we can.
And that'll come up in
Sure
January
will.
this
Yeah.
year? Yeah,
Mhm.
that'll be good.
Yeah.
I think I'm for them. I think
Mhm.
it's really important. Right, and then the septic tank thing, that was the only two things that have popped up on my radar. But so,
Okay, great. Any feedback from?
I mean, yeah, I don't think I've been here long enough
Yeah.
to really know, right? Like,
Yeah, I get
no,
that.
it appears, my observations have been consistent with what everybody else has said, that, the department's collecting appropriate data, using that effectively, given the, resource limitations. Not really any feedback for orientation or development. I think that's is, again, like Sherry said, overwhelming. That's a new word number, but with a good balance of, sufficient information, but not, completely overwhelming. So, yeah, I just, consistent with what everyone else has said.
Perfect.
Seems to be going well.
You have
Great.
3 years to figure it out before you get
I
to
know,
decide
you're
if you're gonna
gone.
stay for another 3 years or be done.
I think it takes that long to really, to wrap our arms around everything that's being done.
I
like
still
that.
remember that big binder landed on my desk. This is a big job.
We don't even do the binder anymore.
Good, because we would be overwhelmed and we wouldn't absorb it anyway. Like we have to learn, we're learning on the job.
Yeah, yeah,
For me, it's the best
Yeah.
way.
yeah, I agree.
So,
Yes, well, it's been really great. the conversation and the dialogues really picked up. And that's nice.
Nice.
Yeah, it's
Glad to
nice.
hear that.
Brenda talks a little less, we talk a little more, which is really the point of a board meeting, so that's wonderful. Okay, moving into oversight. So the last part of our conversation is around our ability to assume the ultimate responsibility for public health performance in the community by providing necessary leadership and guidance in order to support the public health agency in achieving measurable outcomes. These may include, but are not limited to, assuming individual responsibility as members of the governing body for actively participating in our governing functions, evaluating professional competencies and job descriptions of the health director to ensure that the mandates are being met and the quality of services are being provided for fair compensation, maintain a good relationship with the health director in a culture of and manner of trust to ensure that the public health rules are administered and enforced appropriately, hiring and regularly evaluating the performance of our health director and acting as a go-between for the public health agency and elected officials when appropriate. Thoughts on this piece?
I mean, this again seems to be a strength. I think this ties back to the partnership building. This seems to be a strength of the department and of Brenda and her team of sort of pushing developments in the community and drawing in community partners, but being the like kind of leader, the voice of leadership in a lot of community initiatives that are much broader than what I think the department alone could achieve. I think that one thing that I've noticed when I went to the last film screening, it was the first time I had been able to go, and I was contemplating, I think I was the only one from the board there, but I hadn't been able to go before that. And Sherry had gone, and I was contemplating that we kind of do a poor job as a board of planning, like, you know, making sure that the board has representation at community events. Obviously, we can't all go to everything, but so far I've just been going to events sponsored by the health department or presented by the health department if it fits my schedule, not knowing if another board member could go or not knowing if there would be any other board presence. And I think there have probably been some things where there has been no board presence. So maybe for us doing a better job of articulating, you know, and kind of roles or, you know, responsibility sharing as far as showing up to those events amongst all of the board members. And being more mindful about that, I think could be an improvement on our end. But as far as I think the department goes and the staff goes, I think this is, again, a really strong point for Brenda and her team.
Thank you.
I second that we should take turns by agreement, maybe one of us, at least one of us, going to these important events within the community, because we're not going to get a broad overview of the scope of what the community is talking about and needing and wanting from the health department unless we come to these meetings. Well, you guys will have been there, but and give a short presentation of what we learned and share it with the other board members. I would love that, actually.
Yeah, great goals.
There will be a really great opportunity after the new year to engage in the community health improvement planning process. So every 3 years, we do a fresh new community health improvement plan, and it comes right after the new assessment is done, which is very close to being done and published. So February, it'll, in the past, it's been about a 3-month process, and it's a large community facilitated conversation about understanding what the data is telling us, and then developing the goals and objectives to address the priorities that rose to the top. And that's a really great opportunity for board members to be present, participate in the conversations, and hear what other community partners are saying.
So do they Zoom those meetings?
We've done it both ways. We've done it in person, no virtual option. We've done it all virtual. The last time was right in the middle of COVID, so it was done in a virtual setting, no in person. And then I anticipate that this will probably be a hybrid option.
I hope so,
This time
because I'll be
around.
gone to Arizona for a couple months, but
Oh,
I'm gonna zoom in on all the board meetings and anything else I can zoom in on.
Yeah.
I'll do that.
Awesome.
the hybrids, they're challenging, especially in a, not for board meetings. I think we've got this figured out really well. But for those big community meetings, trying to figure out how to get
Mm,
those that are online in conversation,
Oh,
because there's a
sure.
lot of table discussions. But if there's enough people online, they can be their own table. It can be their own discussion, and then somebody from that group can then report out to the bigger group. It's doable.
mhm.
Doable. We just have to be really thoughtful about it
Okay.
and how to build it in. I anticipate it will be a hybrid of some
Do you have a
kind.
schedule of that by any chance?
No, I don't even
coming up?
have, yeah, I don't
Okay.
have a contractor on yet either, so.
Okay, because
that's what
I'll
I'll
be
do.
coming back for at least a week in there, in the middle of that. And I could choose a
Mhm.
week that would be
Yeah.
something that would be really valuable for one of us to
Yeah.
attend.
Okay.
I know that I get
Yeah.
evaluated every year.
Yep, I was gonna say the track, this is where the track star performance tracker emails that we get. I will say as a volunteer board member, those track star tasks are somewhat significant, but it's important. And, you know, I think Drendel thrives off feedback and is always her harshest critic, it seems, on there. But it's, so when you get those track star, that's really, I feel like ties into this oversight, is really how we're tying the performance of our health director into the her professional development goals that then tie into every other piece of the work that happens here. So again, it's a really neat integrated system. And so it's nice to see that functions in place, and you know, when those when it's that time of year to spend the time giving the feedback, it really is important.
I appreciate it.
Yeah.
And we also do the annual update to the board on the strategic plan.
Yeah.
So the board gets an understanding of the progress we're making or the challenges that we're having on our internal organizational strategic plan.
And I haven't really seen in my experience on the Board of Health needing to be a go-between for public health agencies and elected officials, but perhaps when we're being asked to testify and things like that, that falls into different spots. But I would say that one thing that happened this year is as we were trying to find that sweet spot between the needs of the health department and the overall county budget, that was an opportunity for the Board of Health to support Drenda by accompanying you to those fiscal administration meetings that happened. I think it was good insight to really see the way that the administration fiscal department of the county is operating in their perspectives and the elected officials' priorities, and then just really trying to support Drenda how to make that all those puzzle pieces fit together. So that, I would say that was maybe one way that we've done that in the last year.
It's not always needed, but this past year was a very challenging budget year, and there were some really hard decisions that were needing to be made, big cuts that needed to be made. So having board engagement and advocacy at that time as an intermediary between the health department and the county was helpful.
Great. Okay. Anything else from the table on this one? All right. Anybody on Zoom have any feedback on the oversight piece of our discussion? Okay, hearing none, we have completed our NALBO health effectiveness assessment. That's a mouthful. Our immunization services presentation is postponed. I hope Shelley feels better, and we will move into our water quality protection district update from Jennifer, please.
You can be wherever you're as comfortable.
Just that I think that Zoom people will do this. And I make notes because if I don't, I actually forget a lot of things. So good afternoon, I'm Jennifer McBroom, and I'm the supervisor for the Water Quality Protection District. And I guess I was assuming that people would have the packet. Perfect. I did not make a presentation, so what I'm gonna cover though is just a few things that are out of, it's our strategic plan. And so on page 22 is where it starts. It's a 3-year strategic plan. And then in there, you can see how we are progressing through all our goals and objectives. So we have activities that were identified through our board, Water Quality District Board. And then so then the staff gets together and say, okay, how are we going to accomplish those? But I'm only going to pull out a few of those and then just go over some of the current things that we're working on. But first, I'd like to say, and you probably have already heard, but we are fully staffed. We have been for over a year now. And so that is, that just enables us to conduct and complete some of those tasks that we weren't able to. A lot of the field work. So it was just me and another water quality specialist. So we didn't have a hydrogeologist on board. So mostly it was just field work. And then now we're able to do to process that data and get that out to the public. So in addition to that, we've also increased our Water Watchers outreach educator. He's now half-time from a third time, I guess. So we're still kind of looking at how it's still a work in progress. So it's not like he's like right on halftime with the district board's budget, but we're still kind of like working out the details of how he can do more outreach events, whether it's with the health department or with our partner agencies. So, but I'm happy about that. We've been needing that. It was kind of a need for the district that we have all this, you know, we collect data, but we need to get that out. And then public outreach and education is very important, as you all know. So with that, yes, outreach and education. We continue to collect data, but that doesn't really do anyone a bit of good if we don't share and educate people on our findings. So our main outreach message right now is to private well owners is to test their well. So that's one of our main outreach messages. So right now we're partnering with the state lab and offering free manganese testing, and that's funded by the Water Quality Protection District. That test is only available to those residents that live in our district. And we do have a link. I'm trying to think, how did I put that link out? But we did get a map. And so if anyone is like, hey, do I fall within? We do have a link that tells you where the boundaries of the district are.
I have a question about that.
Yes.
Is that, it's only high in certain areas? Is what you're saying? The manganese?
Well, manganese is, we're not quite sure with that. So that's why I know the state lab is doing a push for all their public water supplies. And so it's really kind of, it's kind of like on a first serve come first serve basis right now. It's not required. So manganese, depending on the levels, and that's something that we haven't always tested in our parameter suites. So we kind of went through our data and said, hey, where have we collected? And we reached out to our network people. And then we have a radio ad and other messaging out there for manganese. It acts like, for younger kids, it acts similar to lead levels.
Mhm.
It really,
Affects the brain?
yeah, and I'm trying to think of how to say that very. So problems with memory, attention, motor skills, under 6 years old, kids are more susceptible to excess manganese for neurological. That's the word I was thinking of, neurological systems. So.
When we live in the county, and I had my water tested through Alpine Analytical.
Mhm.
And they gave me all the readings, but they didn't really do a summary of like, what does this mean? Seriously. So they did say that the Missouri River carries a high toxic metal in it. And I couldn't remember if it was manganese or what is it? Do you know?
It's arsenic.
It's arsenic. And is that coming from or do you guys know, is it coming from the farming, from the?
No, it's natural.
Okay.
Yep, so that was one of another free test that we're doing. So in addition, I think I talked to you on the phone, I'm not
Oh,
positive.
probably.
So manganese testing is free to residents in the district.
So
But
what
then-
is the district?
So the district's boundaries are, and I think if you, yep, so if you look in the packet, and we always have this on our page in the water quality district packet. But it really is kind of to the west is top of the pass, McDonald Pass. To the north, it's like, are you familiar with North Hills?
Yes,
So I'll just say the tree line.
okay, yeah,
And then to the east, it's like the Spokane. It's not quite the Spokane bench, it's just a little bit further than like the regulating reservoir. And then to the south, it's the county line. So I think there's like a subdivision to the east, maybe Wheat Ridge, that is completely out of our district.
Mm,
So it's, yeah, so it's very limited. We have in the past, and we'll start rethinking of this when things have kind of calmed down with, I shouldn't say calm down, but it's just not a very good time to think about increasing our boundaries.
mm,
But that is something that we're gonna, we wanna think about,
okay.
maybe being all countywide. But yes, in addition to the manganese, we actually also do arsenic and uranium. And so the funding through that was actually through funding that the county got. I think they ended up with about $13 million. You applied for that and then you were awarded. So the district was awarded $27,000 to for anyone in the county to test for arsenic and uranium. And then if it came back at or above the MCL, which is 0.01 milligrams per liter, then or 10 micrograms, then you can get $300 for a treatment system. And typically it would be a reverse osmosis. That basically takes out about 98% everything.
Hmm.
And then you can have the option of putting some of those good minerals back that kind of makes your water taste, enjoyable. So we do participate with the state lab on that. That's not to say that you can't go to any other of the 3 labs that we have here in Helena, Alpine Analytical being one of them, Energy Labs, but the state lab actually has the lowest cost and was able to give us a discounted price for arsenic and uranium. Manganese as well. They're coming at a really good price compared to the other 2 labs. So that's why we partner with the state lab. Like I said earlier, we also participate in events both with the health department and our partners to spread the message of test your well. But then we also educate on water conservation. So it's water quality and water quantity. So water availability as well, and work with a number of partners with that as well. The district does have on their own webpage under the health department that there's a section in there that has interactive mapper, and you can actually go there and it will display all the data that we have that we've collected and then also has been submitted to us from residents. It's not necessarily our project, but it was somebody, and we've got full permission to and then we would there's no names. We always use a GWIC number, Groundwater Information Center number, which another story, but that's with the Montana Bureau of Mines and Geology. But anyways, you can actually look at other data on our website, water levels, water quality. So, and if you have any questions or anything, just give me a call. But also on our website, there's a lot of good information there too. Like I said, the mapping site, but we also have something called the 10-mile flood area. So we actually have a way, we've increased our monitoring of wells in this 10-mile flood zone. And so during that flood season, we ramp up our monitoring water levels, and then we actually put that up on the website. So people are more, instead of looking at a USGS gauge, they can actually see when the groundwater is coming up, and then that will be alerts. We're still trying to do some other real-time monitoring, But for right now, it's just a way for them to say, oh, this is where my level is, or my water level is. This is my alert to say, I gotta get stuff off the basement. I've got to start clearing things up. So, and we work closely with Warby McNamee, who is the floodplain manager. So we get consistent messages through him and the National Weather Service and put that up on our website during the flood season. So that's outreach and education, just a little bit of that. And then another area is the district has just completed a small water study in the North Hills. And then through that, we were looking at wells that were monitored in the past. I think there was a study from Montana Bureau of Mines and Geology in 2010. So we tried to grab those same wells and also do water quality and water quantity and see if there's any changes due to land use changes, like increase in development. What's it doing? What are our septic systems or land use practices doing to our groundwater? And that could be found on page 28 of your packet if you're following along. There will be a report out on the North Hills, and I'm expecting, because we're sending out this week our second letter to residents about the results and what it means. So, yes.
So I ride horseback in those hills and I've seen the wells and it looks to me, is it coming from old mines? Is that what they're monitoring the water for? There's mining that's gone on up there?
So are you talking the BLM lands off of Head Lane?
And off of Echo Lane, yeah,
Oh, Echo, okay.
yeah.
Yeah,
Were
that's
those,
I love taking my dogs up on that.
yeah,
So those in the past, I'd probably have to say like 5 or so years, we did have access to those wells. And our former hydrogeologist was monitoring that. That area is typically high in nitrates. Because of what I've heard is because of past artillery, firework, or fire
Rounds,
ammo.
ammo.
Yeah.
Landmines.
Explosives.
Yeah.
Yeah,
Hmm.
yeah. So we have not, I know with our former water quality specialist, we try to get a hold of BLM, because it's BLM, Bureau of Land Management, and try to get access to those wells so we can monitor them again. But we haven't had any luck. And to be honest with you, it kind of got dropped off the to-do list. But so I can't really, say much to those lands there, but.
yeah, the chain, oh, go ahead.
The maps that you post up on the website show where you're monitoring though, right?
Yeah. Yeah.
I wonder if I can pull up the website while you're talking, Jennifer, and
Yeah, because I remember going out with our former hydrogeologist, and we actually have a key to go in there off of Head Lane. And we drove to a couple of those wells that we monitored. And those wells now, I think what was going on is those wells were used for a previous project called the Mount Penn. And it was in conjunction with Bureau of Mines and Geology, and it had to do with the precipitation. So he was seeing how it was an oxygen, and I'm saying this in very simplest terms, but it tells you where we get our precip from.
Interesting.
so let me.
So they just spray painted all those wells bright orange or pink.
Oh, they
hot
did?
pink, so there's some activity, something going on up there.
Oh. So I go off Echo and I call it, it's just like a little triangle, and it seemed like they're improving the trail system. There's
Yeah,
been some
these-
additional trails that have been going on.
They've done the parking lots.
Yeah, I saw that.
Yeah, but the trails, I haven't noticed anything where I ride. And the wells are well off of the trails.
The trails, yeah.
Yeah, they're on the opposite side of the road.
Yeah.
So I was just curious.
If you go to, I think you're on it, interactive mapping, and then go to, groundwater story map.
This is one of those really impressive data maps that lets you see the data that we are collecting, the water qualities collecting.
This was, I think it was 2 years ago that the Water Quality District out of their budget, worked with a consulting agency to give them all our data and to kind of be able to create this. They didn't create this map, actually Maddie did, and then our new hydrogeologist, Keegan, is updating it and kind of, so that's Maddie, our old water quality specialist.
I was looking for them. Is the map?
It's just, yep,
Oh, it's just loading.
you gotta go down a little bit more. Oh, maybe that was it. But you do have to click in that little box before yours.
We'll let that load while you continue to.
So, and the third thing I wanted to talk to you, oh no, actually I have another item. Another project that I'd like to talk to you about is we have been working on restoring Grizzly Gulch. It's a former placer mine up Grizzly Gulch. It's called the Pretty Girl Placer Mine. And that was a mine that was back in the 1800s, and it's gone through multiple landowners. The last landowner actually forfeited his bond and his cleanup bond, and it went to DEQ. So we're using those funds, which was $10,000, and then additional funds that we applied back. This whole project started back in 2019, and had to apply for reclamation and development project money that goes through the legislative session that you get approved. And then I think that was in 21. And then you have to wait for the money to come in. It's coal tax money. And so it was like 2023 before we got the go ahead to say, all right, you got money. And so we've, got got the money. We've hired through that grant Respect to manage the construction portion of it. And right now, this week we put out the bid notice and had a pre-bid meeting. And so it was kind of interesting because I didn't think we would have anyone, to even come in and would be interested in the project. But if everything goes well and they come in at a good cost, we're looking at March is that we will start construction, and then it's a quick project and should be completed by the end of April. And then that at the end of that project, there's also revegetation because we're going to be restoring the floodplain as well. And so we'll probably have a volunteer effort to cut willows and plant willows and plant some other vegetation. But that also can be found on page 29. You could see some of the pits and the pictures that were there is part of our monitoring plan for this project is to take water quality annually, and then we also look at that riparian and the habitat as well. And so we had to submit a huge monitoring plan for that. So, but I'm very excited that this is finally, after 5 years or so, it's gonna take place, hopefully, because it was 2019 cost, but now we're in 2024 cost. So we're not quite sure if we're gonna.
It will be different.
It will be different. So if you are interested, it does have you know, a legend here that will tell you. So water level monitoring is just blue, and so you would actually, you would have to zoom in a little bit further to see. And it'll probably take a minute, but you can, you know, on your own time, probably see and probably find the well if we did monitor it in the past.
I can't get rid of this window that says when you're finished,
Oh.
scroll, but when you
Yeah.
click on it, it gives you the information here, right?
Yes.
But-
Yeah,
Oh,
I think if you scroll down, scroll there, and then now click on your map. But if it'll give you a hydrograph, it'll say active or inactive. It'll say if there was any water quality results taken. I can't tell.
it has the depth of the well. This one's in an inactive well. The one that I clicked on.
Yeah,
It's a water quality use only, so it's not a residential, which you monitor a few of those too,
mhm.
residential wells.
Yeah, I just can't tell if that's just right off Bird's Eye Road heading out. Because we do have wells that are just off Head Lane, up Head Lane before you get to, well, the Head Lane access.
On a computer that functions a little better, you could really enjoy a lot of the data that's on the website that they've worked really hard to get out and make public.
And so what I'm gonna end on, and this is on page 33, is upcoming legislative session. So I just wanted to say, that is something that we track bills, we inform our board. I do know that, I had a meeting with not just me, but it was, other entities. It was the county planning, it was Beth Norberg with environmental health. And there is a proposed park that's being planned for the North Star subdivision. And so I don't know if you've heard, but North Star and in that area, especially the North Hills, has always kind of had some kind of water availability issues. And so for them to have a park and then have a bunch of trees that they have to water, especially in a subdivision that they are on very highly restrictive water use during the summer. Irrigation use, even in the city, irrigation, that's why Missouri Water comes on in the summer. And we all don't drink 10 Mile, wouldn't that be great? It's just, it's gonna be a heated discussion, just because here you have a subdivision that can't water, but then here's a park that's gonna need water for whether it's grass or trees, so. But what's coming down, at least from DNRC, is that they said that they're looking at drastically limiting the water with exempt wells. Exempt wells, and Bree, you probably know exempt wells, but so exempt well is it's a permit where you can get for smaller wells. It's kind of a way to get so like a public water supply is typically one well and then it feeds so many. This is a way to get around that. And you can only use 35 gallons per minute or 10 acre feet. And so what DNRC is looking, and there's going to be multiple bills, and there always are every legislative session. And so we just try to track those. But that is going to be a hot topic through all of Montana, is the exempt well issue. So, but that's all I had planned. If you have any other questions or any questions?
Okay, thank you. Appreciate the presentation.
Thank you.
More valuable than gold.
Waters.
Right?
Water is
Life
life.
force. Jinx. Next up, we have our behavioral health system improvement update by Jolene online. Hi, Jolene.
Hi, everybody. Jolene Jennings, Behavioral Health Systems Improvement Specialist. My voice doesn't usually sound this low, but I am dealing with virus stuff just like Shelley, and have bronchitis too now today. So please bear with me. I'll try to speak as loud as I can. And if I start coughing, which has been happening when I talk too much, I'll just have to take a cough drop. Hello, everybody. Nice to see some new faces on the board. It was nice to listen to some of your feedback so I could help try to cover some items that might be informative to you. So I would like to, I'm going to jump to actually share our website. Let's see. Let's see if we can do a share.
You should be able
Whoops.
to, Jolene. You're good.
Yeah, I'm trying to get it accessed on mine, but it doesn't seem to be coming up. Could you do me a favor? I don't know if you can, just open up the behavioral health page on the public health website.
I sure can. I'll work on it while you're
While I'm talking. Thank you.
Mhm.
So I just wanted to go back a little bit instead of just doing an update because I know a few of you are new and just talk about when I started in June 2020, the public health hired me to start to work on crisis systems development for behavioral health with design and identifying what we have for current services, what the flow is for a crisis response and stabilization, and then trying to build what we need from there. And so that was done with key partners in the community. And that was primarily with the Behavioral Health Systems Improvement Leadership Team. And this page that I asked Brenda to open up is a behavioral health page on the public health website that you can reference for a lot of the information that I'm going to talk about. Talks about the history. And then if you scroll down below a little bit, Brenda, all these tabs below will talk about details and give you access to some links in there too, which I'll reference through some conversation. And if Brenda wouldn't mind opening anything up as we go along. So
I'd be happy to be your Vanna White.
I'm sorry, I got it all set up and now it's not giving me the option since
That's okay.
since Jen left. So I would say I wanted to just talk about the Crisis Now model was what we identified in the first year of doing all that preliminary planning on the design. There was a lot of research involved. Many of that is listed on the actual publications down below on another tab. And so what we ended up walking away with was the Crisis Now model, which I think there is a document on listed in there under the crisis response tab. Excuse me, is 3 pillars. It's a national Crisis Now model, which focuses on behavioral health and law enforcement, both, and also separate response with just behavioral health for a mobile crisis response team, 988 suicide prevention and mental health crisis lifeline, which is a person to call. Mobile crisis response team is a person to respond. And then the crisis facility, which is a minimum of a crisis receiving facility, is a place to go for behavioral health in the community. And so those are the 3 pillars we've been working on for the past few years, which hopefully you are all familiar with the 988 system, which was stood up in July 2022. And we worked with the Department of Public Health and Human Services on the strategic plan for about 9 months prior to that, with trying to communicate through our county coordinators across the state, worked together with them. And so I sort of have a AKA name of a crisis coordinator besides the behavioral health systems improvement specialist. And so, you know, they took some of our feedback and then also was able to launch that platform to not just be the suicide prevention lifeline, but also the suicide prevention and mental health crisis lifeline. So that way we invite a wider audience of behavioral health crisis into that 988 system, which provides 24/7 response through that 3-digit number, which is an easy to remember number. And it is free to anyone. There's no insurance required, and it's anonymous unless there gets to the point where, you know, somebody is identified to be in a crisis. They need the next level beyond de-escalation, which is what the 988 crisis coordinators do. When somebody needs to be in person, they will reach out to the chain of 911, which would be law enforcement and or mobile crisis response team, or they would recommend an EMT to take them to the emergency room. So those are all, that's what's happening on the 988 mobile crisis response team, which we've launched in Lewis and Clark County back in November 2020, with the county working on funding that supported that with the crisis diversion grant, formerly called the County Tribal Matching Grant. And then St. Pete's was the provider who stood up, who became the provider for took on that mobile crisis responsibility team, crisis team responsibility for staffing and working with us on getting that up and running. In addition, the last piece of that was the crisis facility, which we are in the final stages of the last piece of the pillar to stand up. And so it's been a long process, but primarily due to low funding and sustainability of the previous crisis facility. And so trying to get enough funding and support system set up so that way when it's reopened, it's open and stays open. So that's referencing in our county, Journey Home, which would be the crisis receiving facility, and hopefully a crisis receiving and stabilization facility in its by its second year. So that is we're waiting with bated breath on trying to get that open. There's been a couple of complications that have delayed it from opening in December this month with some of their other building structures. And so it's been a priority thing for them. And but they are still moving forward on getting the facility readied. The receiving chairs for the crisis facility have been delivered to them, and they will be set up as soon as they have the complete building back to be able to do that. There's been sort of a borrowing of space from their other locations due to some construction going on. Before I go on, is there any questions on the Crisis Now model? Okay. Then I will go on and say, so what I would say the next step would be on funding. So just part of what we needed to do through this whole development is also identify funding. As I mentioned with the crisis facility, you know, advocating through the legislature and our partners on advocating for increased funding for Medicaid reimbursement over the past few years, and then also creating a new funding reference or item for the mobile crisis response team, which had very minimal Medicaid reimbursement. They could only bill for an assessment on scene under the standard Medicaid benefits, and it had to be a certain level of licensure for the individual responding for the behavioral health professional. So through many support across the state from a couple of the providers that are standing up mobile crisis response teams, we all work together, and many of our collaborations from the county have spoke up to in public hearings on the policy, which was policy number 452 for mobile crisis response team bundle for reimbursement through Medicaid. And so that has been approved and has been implemented with just starting to be able to be billed last month. And so the goal is to get that to be sustainable funding so they're not reliant on grants as they were in the past. And it's recognized as a medical need, crisis behavioral health, crisis response need in the community. And just to add to that, on the mobile crisis response team, we are in this county combination of law enforcement and behavioral health response, which is a co-response And that is, we rely on law enforcement to, meaning we, sorry, it's gonna take me a while to stop saying we with the counties so much engaged in that in the beginning. So St. Pete's Behavioral Health, their mobile crisis response team needs to wait for law enforcement to call them in to a behavioral health coded call. And that's how that works right now. They do have some sites they've identified as the safe enough to be able to respond to with current providers that already have, screened somebody. They've been in maybe a counseling session and they know there's not any kind of weapon available to them. Then they can respond to that directly without necessarily getting a call from law enforcement to go to that scene. So that's something we're trying to grow a little bit through our enhancing and expanding of the mobile crisis response team as a future initiative we've been working on. And other funding that we got in besides the Medicaid is through the HB 872 Commission for the near-term initiatives that came out this year. And we advocated for the crisis response services. And so a mobile crisis response team, we received a year of operational expenses this year. That also supported the funding for the crisis receiving stabilization and emergency beds here. And that was something hopefully you're familiar with. If not, you can find that on the Department of Public Health and Human Services website under the HB 872 Commission. It's called for Behavioral Health Systems for Future Generations. And so that's how we fund. Those are some new funding sources which we've worked on this past year. And I think I would say, just to respond to some of the board was talking about importance of really working in community with collaborating with partners. Our key platform for starting this process was through developing partnerships with the Behavioral Health Systems Improvement Leadership Team, which composed of law enforcement, the county, the sheriff, the Helena Police Department, the county commissioners, behavioral health providers, Shodare, the hospital, and St. Pete's. And then, I'm sorry if I'm forgetting anybody, but those are the top partners for the leaders we started with. And we also collaborate with our local advisory council, which the full name is Lewis and Clark County Behavioral Health Local Advisory Council. And so there's many consumers and behavioral health providers on the LAC. And so there's where we do reach into the community pretty deeply. And so there's an opportunity to learn more about that too at one of our LAC meetings, which is the first Tuesday of every month at 11:30. And then I would say the last two things that we've added this year, actually started one last year, is the leadership team decided to do a couple of subgroups on our pillars to focus more on the operations and details versus the systems for the leadership team. So we started a mobile crisis response team community coalition last August. And that also braided into our planning work for the Bureau of Justice Assistance funding that we got. Sorry, I didn't mention that one yet. But that was a big one that we got. And that is working more directly with law enforcement and sharing more, have a more of a data sharing system. That's the ultimate goal. And also expanding and enhancing the mobile crisis response team within our community, and also touching on the neighboring counties with where our rural areas of Broadwater and Jefferson with low service and behavioral health providers accessible to them. And I think one of the big accomplishments I'd like to show on this webpage, Trent, if you wouldn't mind, is the Behavioral Health Crisis System Dashboard, which some of you know about, but not all of you. And I think this is something a great reference to see the picture of how these three pillars work, and then also to see all the braided data that goes into this. This is something that we strive to update on a regular basis, usually quarterly. I have to admit we've been a little behind because we went for the Behavioral Health Bureau of Justice Assistance took a best practice site visit through some funding to the East Coast to Portland, Maine, just the end of October to get best practice ideas for enhancing and expanding our mobile crisis response team with behavioral health and law enforcement. And so there's more data to come here soon. But you can click on, oh, can I click on this? So your welcome page, and then every pillar, you can click on pillar 1 for 988 data. And this has been about a year and a half that we created this dashboard, which is public access, another communication tool. And so there's layered data on some of these tabs, not number of 988 calls resolved in our area, total calls, behavioral health coded calls, and then number, like you can see the de-escalation versus how many were not. And so those would have been transferred on. And the pillar number 2 for the mobile crisis response team. I know you guys have a schedule, so I don't want to take up all your time. Has a really robust data system too. And we give a little explanation on the left side for people to familiarize themselves with the fact that this is part of their community. This is a service in their community that they can access through 911 and let them know that they have a behavioral health crisis and they would like to have a mobile crisis response team come along with 911. That's okay to make that ask. And so again, we're getting a lot of key data from St. Pete's Health emergency room admissions and also their mobile crisis response team. We've been getting robust data since we started in 2020. And this feeds into why we come up with this data, where we come up with this data and the percentages. It is a great partnership that we have with them. And this shows people what the needs are and what the services have been. And we have to talk a lot about the diversion from jail and also the emergency room as a big focus in our county. And the last one is the pillar, for the pillar 3 is the crisis stabilization facility or crisis facility we listed there because we weren't sure if we were going to go into the cream of the crop with crisis receiving and stabilization. But we know that it's because of the cost and the need to get the right qualified staff in, that it will take time to be able to make that happen where we grow into a full crisis receiving and stabilization facility and even have emergency bed for involuntary in there. And so that's what's happening for future in our county and through the behavioral health crisis work. And then lastly, you can look on this webpage and you can see a lot more expanded work with some of the other initiatives, I would call them programs coming in. And we all know that the suicide prevention has been there with Safer Communities Montana and Lost Team. But now we have the substance use misuse prevention and opioid education prevention and naloxone distribution there too. And so it's really a lot there, a lot of services going on and a lot of those some new staff in those programs. So I'm trying to work with them to bring them up to speed on what we've got here, and love to have them maybe come and talk to you guys in the future too, when they're got a few more months under their belt. So a lot of data here on this website to look around at. I definitely would recommend you check it out. And this is something at your fingertips, so you don't have to go back to a PowerPoint presentation. Is here for you, and we continue to update it on as we can. Any questions?
I have a couple questions for you, Jolene.
Okay.
Very great presentation. Thank you. The first question is, who owns the Journey Home business and how is that being managed in the community? And it sounds like there might be a contractor that's been hired, Many Rivers Whole Health.
Correct.
Can you explain that? And then in your explanation, I'm also curious who the employer of the crisis response team is and where's that all seated? And also,
Okay,
what are their hours?
Sure. Let's start with the crisis facility question that you asked. So the crisis facility, which is the Journey Home, building, right off Last Chance Gulch. That is on the property of Many River Soul Health, formerly Center for Mental Health. And so the county agreed to sell Many River Soul Health, the building at I think the June commission meeting. And so that went on. I think they purchased the building, actually took ownership of it in August. And so now they own the building, the Journey Home building. It makes sense because it's already on their property. The county owned the building only, not the property. So, so they are now at the lead of getting this open. We've done everything we could through the county to make sure this is moving forward and giving them structure. And we went through 2 RFP processes. And so they are now leading this with moving this forward with getting the place ready at this point. And so they will be the ones managing it once it's open.
Okay,
Their
thank
aim,
you.
they wouldn't give me a final date. I talked to them just a couple days ago. They've, like I said, had to temporarily take stuff out of other buildings for some construction issues and have to delay that. And so they can't get their licensure to open until the facility is walk-in ready for somebody to come in. And so that means all the chairs all set up, no clutter inside the facility, all the ducks in a row. And that's when they're going to apply for their license. And then they're starting to do job descriptions, but not hire until they know that they've got the license in hand. So it's a little longer than we wanted it to be, but I think it's probably going to be pushed back until another couple months.
Okay, thank you.
And then you said the mobile crisis response team is based out of St. Peter's Health. St. Peter's Health is managing that from beginning to end now. We do help with some braided funding through the county for the Bureau of Justice Assistance grant that we secured a little over a year ago, or a year, let's say, I think it was September 2023. So we secured that, and with the plan to give majority of the $500,000 grant to the program operations with the intention of the enhance and expanse as a goal. And so that will, the first year, it's a 3-year planning grant. The first year is planning, and we are just going to be finishing that up at the end of this year, completing a strategic plan. And also we went for that best practice site visit to take some ideas back for how we can maybe improve our system even more, so instead of just enhancing and expanding, is taking some best practice models, such as one of the things the group that went, the law enforcement chief Petty, Gianluca and Jeanette from the Mobile Crisis Response Team St. Pete's and myself went out, and amazing system they have set up out in Portland for behavioral health and law enforcement collaboration on response and stabilization and continuum of care. But they've got a lot of years ahead of us. But one of the key takeaways was from the group was on, and that's the benefit of coming from the community who's going to have to put this up, right? Is the law enforcement in St. Pete's Behavioral Health for MCRT is thinking about substance use response, actually having a liaison in the community, and maybe a potential pairing with a civilian, which would be more of a peer support. So that way, when they meet somebody in the scene, they're able to get them to talk about what they see and build a relationship, but also having somebody who's lived experience as with the peer support, they're more likely to listen to them to go for treatment. And so that was
Right.
be the goal, is to get them to treatment.
Yeah.
So
Thank
that-
you, Julie.
That's
One
just
more
a
question.
envision. That's just a vision right
Yeah.
now.
One more question, just when is the mobile crisis response team available to respond?
Sure. Their mobile crisis response team right now is 24/7. Unless there's only one team member right now per shift. They've hired 2 per diem people to try to balance off when somebody's out on leave or sick or on, we need a vacation once in a while. Or when we had COVID, there would be a shift that was missing. And so if they couldn't get somebody to cover it, they would have to go without it. So we're going through some changes now to see how this is going to work with having the 2 per diems on. We have the most coverage in the state right now for MCRT. but they're also looking at trying to see about if they have such a low amount of response during the times of 2 p.m. 2 a.m. to 6 a.m. That they're thinking of trying to reduce those hours a little bit so they can have more often have 2 people on at a shift so they can respond to more locations and also be able to be out in the community more.
I imagine you're staffing the incident that happened at Jester's and, With
I'm
the-
staffing, I'm sorry.
well, I'm imagining the crisis response team will look at what happened at Jester's with that individual that ended up dying. And it sounds like nobody from the crisis response team was available at that
Yeah.
moment. That's where my question came from, because I wasn't sure
Mm.
if it's only serving people in certain hours of the day or what happened there. and
Well, if
What
they're
a
already on,
tragedy, but
of course, it's heartbreaking for sure. And so, yeah, I'm hearing it from 2 different angles, from the community, from law enforcement, from mobile crisis response team. And it's under investigation for the sheriff's department. So, we have to leave it there. But I would say that I have been asked, about sharing some, trauma services there. And so that was in discussion through our community, mobile crisis response team community coalition. And so, if they can't be there and, there's a lot of questions of who should be doing what, but, I think that, I'm just looking to have a full assessment and shared
Yeah.
is what I'd like to have and have some transparency. And again, that will have to come from the sheriff's office. But I did ask mobile crisis response team if they would be able to go to a place like that, the bar and be able to provide aftercare with not, just checking. They do that. They just weren't called to do that. And so they can go in and check to see how somebody is living through that trauma around them, and then provide them with services or connect them or give them handouts. And so we're usually doing prevention work versus intervention work and crisis work here, in the public health. So I don't have that job, but I will advocate to have somebody in this position and make sure that there is something out there, because obviously the law enforcement and obviously the individual is a loss of life. There was a injury to the law enforcement, and there was trauma all around. And then I don't know how many people were left inside the bar. But
Jolene, I actually have a question related to
suggested
that.
follow-up.
Yeah, I have a question related to that. So if the mobile crisis response team is activated by law enforcement, how extensive is law enforcement training in being able to identify a mental health crisis? And I'm asking that question in part because it says on the website 1% of the 402 required responses in 2022 resulted in Montana State Hospital admission. That seems like an alarmingly low number. And so I'm concerned that maybe people in severe mental health crisis are bypassing the opportunity for de-escalation through mobile crisis response team at the judgment of law enforcement and not of a mental health provider.
Yeah, that's a good insight and good question. I think the goal of starting mobile crisis response was to have diversion from Montana State Hospital. So I would say, prior to that, they were going to the emergency room first, right? And mobile crisis response team can't designate that somebody goes to Montana State Hospital. They're not qualified to do that, but they would have to go to the ER anyway. So we would not always see that referral from the ER, but that was, in a situation where maybe it was designated while the mobile crisis response team was still at the scene. But I think there's a lot, that's Montana State Hospital is a whole nother conversation on that situation with the inability to continue to take the same amount of people as they used to, and the demand in the community now.
And is law enforcement, where does the law enforcement training come from?
Sure.
And, yeah.
So twofold. One of the benefits of having mobile crisis response team co-respond, and we advocated this from the beginning, the value is law enforcement is learning the best practice of how to respond to somebody and de-escalate with a behavioral health professional when they go as a co-pair, as a co-responder. And so, but they do get, and they've gotten before a mobile crisis response team started, it's called crisis intervention training, CIT training. And so that's where the officers have been learning it. You know, it's only been recently that I believe they've been mandatory to go through the training. And so I believe there's 50 officers, and as they come on, it's a full week, 40-hour training, and they train along with behavioral health professionals. So that way they're hearing all the stories, you know, and scenarios, and then they know they have the faces that they might be working with in the community in regards to bringing somebody for help. And so the challenge is it only happens once a year here in Helena in March. And there's, I believe, I'm not sure the numbers. I can't remember if it's 20 or 40 people go into the session, but it fills up each time. And so that is something that's been in existence, and we keep encouraging. And then, but I think that MCRT On Scene with law enforcement is creating a stronger education for de-escalation.
Thank you.
Thank you.
And the Mobile Crisis Response Coalition that she keeps referring to includes both law enforcement representation as well as the folks from St. Pete's that provide the service. And so that in that space, they're constantly talking about how do we do this better?
So that would assumedly be leadership from law enforcement, not.
Who
patrol
participates,
officers.
Jolene?
Chief Petty.
Chief Petty, so leadership.
Chief Petty in one of the sheriff's office. We usually have a sheriff. Maybe it could be the captain, I think, from the detention center, or another sheriff will come in. But we just had Chief Petty, I believe, in this last meeting that we just had.
And it was Chief Petty who also attended the site visit, the best practice site visit in Portland or in Maine. So he's highly engaged.
Yes,
And working very closely.
I would advocate to say that we've seen a big change in participation with behavioral health with his becoming chief just 2 years ago. So, you know, as you know, Drenda's work, it matters at the top. Leadership has to believe in it and then pass it down to the expectations of their staff. So, and officers. So I think we're on a good path. Nothing's perfect. There's always room for improvement. And so we have the gates open to talk. That's the most important thing. They're willing to listen and talk to us.
Any other questions or discussion? Jolene, good job. It's incredible work that you've been doing, and just the way you've really put time and energy into helping the data track the story. Oftentimes in public health, putting numbers to prevention is really difficult. And I think that this program in particular and effort has just from the very start had a real commitment to tracking the progress over time. And it's really been neat to kind of watch it. And I think it really paints the picture and makes the evidence for the importance of it. And it seems like the funding's following, and good job.
Thank you.
Great
It is a team effort. Thank you.
Mhm.
Jolene does an excellent job in this role, and I'm proud that the health department's leading it in this community. So.
Thank you.
Thank you.
No more questions. I am going to sign off. Thank you, everybody.
Thanks, Jolene.
So Jolene works in the health department?
Yes, her role is behavioral health systems improvement specialist. We hired her back in 2020 is when she started under a seed grant from the Montana Healthcare Foundation.
Wow.
Yeah.
That was good timing. Yes, with the COVID.
Yes, it was. I don't know if she would agree with you, but it's
No.
timing because her
I
role
know.
was coalition work. Her job is to bring partners together, which was very challenging
Yes.
for 2 full years where you just couldn't bring people together very easily at all. A lot of Zoom calls. So,
He's excelling.
Nobody wants to deal with it. Mental health.
yeah, it's big. It's really big. And there's so many different elements to the work that needs to happen. And it has to be done at the local level, It has to be done at the state level.
Yeah,
We have to have
everybody.
support at the federal
Mhm.
level. So it has to be interconnected and supported at all of those levels. And I think that we are doing what we need to be doing at the local level and advocating for the support that we need both at the federal and the state levels. So,
So in the past, there's been huge holes
yeah.
in behavioral health,
Oh, yes.
huge.
Yeah.
And they come and go. I mean,
Yeah. And it's funding dependent
I
usually.
know it.
We'll get really great things going in the community and then we'll lose the funding for it and then we'll lose the service. And
Yeah.
A perfect segue into your next discussion topic here,
Okay.
Medicaid expansion.
here we go.
Mhm.
On pages, help me out with the pages.
43.
Yep, 42, 43. There are a couple of documents that were put in the packet for you. The first one I'm going to refer to is the one that the Budget and Policy Center put together that just explains Medicaid expansion a little bit. And then I'll get to our local data, which is the page 42. So, 43. So starting on page 43, I'm just going to give you a couple of the highlights that were that was put out by the Montana Budget and Policy Center. And I start here because not everybody understands Medicaid, and it is really complex and really complicated. And so just doing a couple little tidbits for the board today. So Medicaid is a joint federal and state program. It is intended to provide health insurance coverage for low income. Medicaid is specifically state administered, which means a lot of decisions get made at the state level about what the program looks like, what services get covered by Medicaid as a payer. Back in 2014 is when at the federal level, the Affordable Care Act was passed, which then opened up the option for states to adopt expanded Medicaid, which would then include coverage for adults ages 19 to 64. Prior to it was really just children and adults with pregnant women, families with children, those with disabilities. And so expanded Medicaid then included adults 19 to 64, and then also it raised the income to 138% of poverty. So it worked to add almost 90,000 Montanans to and having access to insurance coverage for medical needs. So in Montana, then in 2015, the state legislature agreed to expand Medicaid. It was voted on again in 2019. And then and in 2019, there was a termination clause put in, which essentially said it will sunset in 2025. So Medicaid expansion and the reauthorization of expansion will be heard during the legislative session. It's probably one of the biggest topics that will happen. So because public health works so hard to make sure people have access to care, insurance is a big piece of that. And so it's really important from a public health perspective that people continue to have access to care. So what we know is if individuals don't have health insurance, then they don't get their preventative care taken care of prior to it becoming an emergent or urgent need. And so individuals that we saw it in the data, individuals that did not have any kind of health insurance coverage would wait and not go to the doctor until they were really, really sick. Then they would end up in the urgent care and the emergency room, which are two of the highest cost services for healthcare. And so having health insurance in place really promoted those preventative services. So just going to the doctor on a regular basis, getting those checkups on a regular basis. On the second page, 44, midway through that page, you'll see a whole list of services that Montana adopted and pays for. It starts with physician and hospital services, pretty straightforward, rural health clinics, federally qualified health centers, so Peerview and Helena Indian Alliance or Leah-Pocha are two federally qualified health centers. And and then many other diagnostic screenings, treatment services, family planning, laboratory services, and so forth, all the way down to Montana included ambulance services, outpatient drug services or treatment services, dental and denture services, which wasn't included before, but Montana chose to add that. Some speech and language and so forth. So pretty robust coverage for Medicaid for individuals that are on Medicaid. So in 2021, there were more than 61,000 enrollees that benefited from having Medicaid expansion to get access to just regular preventative healthcare services. 34,000 in the state of Montana received mental health services, and 5,500 received treatment for substance use disorders, all because we had expanded Medicaid in the state of Montana.
It's better than any insurance that I've ever seen.
Yeah, it's good coverage. So not only does Medicaid expansion ensure that we have coverage in healthcare coverage or healthcare insurance for a good portion. The majority of our residents in Lewis and Clark County have some kind of health insurance coverage. Medicaid expansion has increased that number to way in the upper 90s, 94, 95% of residents in Lewis and Clark County are covered by some kind of insurance because Medicaid expansion is covering what is shown on the one page for you, almost 5,000 residents just in Lewis and Clark County. So that's the biggest benefit, but it's also a benefit to our healthcare systems. And so I was hoping to do this conversation when Justin was still on the Board of Health, because as the CEO of PureView, he could give you stories about how their services have really bloomed and blossomed and expanded because of they have payer sources for individuals who come through their doors. So they've been able to do so much more with their behavioral health services, and they've expanded dental services, they've expanded medical services because they have people coming through the door that have a payer source. They will serve anybody and everybody regardless of insurance coverage, but that means they essentially eat it if the person doesn't have a way to pay. They still serve them, but they don't get paid for the services that they provide. Dr. Bedell could speak to the same situation at the hospital. They are going to provide service regardless of their ability to pay. Medicaid expansion has allowed services to be covered and has allowed our medical providers to expand services, be more available. There are increased substance use disorder providers available in Montana now because of Medicaid expansion. There are more providers available doing the work that needs to be done because we have a way to pay for it, because people can get access to services and they have a way to pay for it. So losing Medicaid expansion, our critical care hospitals in the rural areas, our FQHCs like PureView, they will run the risk of having to close down some of their services, reduce workforce, because they won't have the revenue coming in to support the healthcare system. I think that those are the highlights that I wanted to share that are, highlight the paper itself, the report itself is well done, and encourage you to take time to read that. I tried to pull out the highlights for you. And then focusing on Lewis and Clark County is on page 42. And so this is just a snapshot of what we've seen, the benefits that we've seen to the residents who live right here in Lewis and Clark County. So you can see on the left-hand side there that 88% of those that are covered are below 100% of the federal poverty level. We have 7% of enrollees there that are American Indian, and then it breaks it down by age. So 45% are between the ages of 19 and 34. 32% are between the ages of 35 and 49, and then 23% between the ages of 50 and 64. And then, of course, at 65, they're eligible for Medicare, so they can move from Medicaid to Medicare coverage. So you can see there in the middle of the handout, those are the numbers related specifically to the types of services that folks were able to gain access to. So breast cancer screenings, mental health and substance use services, preventative services, again, saving money because we're getting people in for preventative care rather than those urgent and emergent care services. And then colon cancer screening as well. So I think another big piece of data that is really important to understand is that individuals who are benefiting from Medicaid expansion are working. So they're either working low-paying jobs. In Montana, that could be anything from agricultural to our
Telecom.
hospitality,
Telecom.
yeah.
They
a-
purposely pay them low because
Yeah.
they tell them to go get on the Medicaid expansion because they'll have great coverage.
Yeah. So we have individuals that are working. They're working low-paid jobs, or they're working part-time because they're a student, because they have kiddos at home, because they are caring for an elderly parent. So the majority of those that are benefiting from Medicaid expansion are working. The businesses that you can see there on the right-hand side, we have 910 businesses that employ individuals that are on Medicaid expansion. And what they're reporting is that they have a healthier workforce. They have access to health insurance, therefore they're getting their preventative health care, and they're at work more often. They're at work, they're not home out sick, and that they have an overall healthier workforce. And so those are really important pieces to keep in mind as this is happening. So again, this was my effort to bring to the attention of the board something that's really important to public health, and that's access to healthcare. And insurance coverage plays a big role in access. It plays a big role in making sure that we have our adequate healthcare services available. So workforce is there, programs that we know provide services that are needed. The behavioral health services that Jolene was just telling us about, Medicaid is now covering mobile crisis response. And that is one of the largest payers for that service. If we lose Medicaid, we could lose the service because that Medicaid is paying the majority of the bill for the service that's being provided. What questions can I answer for you? Anticipate that this conversation will come up again. It will be in the session. You probably have already heard how it's quite a bit of effort happening across the state of Montana to help people understand, really advocating with our local legislators. So
in anticipation of you asking for support later, would it make sense that we talk about a Board of Health resolution that we support Medicaid expansion? I'd love to hear if that's something, if Brenda would draft up a letter and we could say that as the Board of Health of Lewis and Clark County, we, support efforts to reauthorize the expansion of Medicaid. Is that something? Could I have a little
I'd be
feedback
completely
about
on
that?
board. So my mother had severe mental health issues like my whole life. And when she finally got into Apple Rehab as a rest home type, and she got on Medicaid, she had private funds before that I was managing for her. But she was never happier. She was never more well taken care of. And it was seamless for me
Beautiful.
as her representative, her guardian and everything. So I've always been for, people deserve a roof over their head, food and medical care, in my opinion.
Beautiful. Me too. Any other feedback about,
I think a letter of support would be great.
okay,
Certainly support it.
okay, those of you on Zoom can sound good?
What I'll do is, I can draft a draft resolution. And we'll put it on the agenda for January, and it will be an action item. So we'll draft it up. You'll get to see it in advance in your packet. We can make edits as needed. And then you can vote on take a formal vote on the resolution. And then that resolution can then be used throughout the legislative session. It can be sent to committee during, when they're doing their committee hearings. It can be sent to the floor. It can be shared with all of our local legislators. So you only have to take action once, and that resolution then can be used throughout the entire session.
I think it's a great idea.
Great. Well, we'll be ahead of the game then.
Great.
Yeah, okay. Thank you for the presentation. Moving on to announcements.
All right, so just, I actually have two announcements. One is on your agenda, the final episode of the Invisible Shield documentary series and community discussion is happening on January 7th, 6:30 to 8:30 at the Myrna Loy. This is also now during the legislative session, and so we're partnering with Montana Vaccines for Families, and they are hosting a reception in advance of the showing. So they're inviting legislators to be present. I encourage board members to come early and partake in the reception and opportunity to have conversations with local legislators and do kind of a social time in advance of the showing.
And what time would that be?
My guess is going to be between 5 and 5:30. And then we'll get the documentary started right at 6:30, so it doesn't run late. And that is the final episode, and I will send out where you can access all the episodes
Oh, great.
so that you
Yeah,
can catch
I
up.
want to know that.
Yeah,
For sure.
yeah, you can go back and you can watch them all at any time. So,
Yeah.
yeah. And then the second announcement is the licensed establishment fee change efforts. We have one final community discussion opportunity that's scheduled for next week. And so this was not broadly publicized. It went directly to our local operators, our licensed establishments that pay fees to be licensed. So restaurants, public accommodations, pools and spas, trailer parks. They got a direct invitation to 3 opportunities to look at the proposal, come and ask questions, give feedback, because now is the time before the bill gets drafted to hear from those who are impacted by the fee change. And so our final it's an online only, not an in-person, is next week, December 12th from 9 to 10. Or 10:30, depending on how many people show up and how much discussion. So I will send that link to the board as well if you're interested and curious. What we've done in the last one is Laurel and Nina and I, there's a presentation that we give that's fairly brief, just to lay out why this is even being proposed. That fees haven't been looked at since 2009, that type of information. Laurel does a good job of going through the proposal itself and explaining what it is that we're looking to do, and then opening it up for discussion and getting feedback. So there's one more opportunity. And then as far as that statewide advocacy effort that's happening, the Confluence Public Health Alliance is taking the lead on all of this, not Lewis and Clark Public Health. And so they have a lobbyist on staff, and they're working with legislators now to find a sponsor and get the bill drafted, knowing that there's a deadline and we need to get the bill on the list as early as possible so that it doesn't get lost in the many, many bills that are going to start rolling in. This Friday is one of the first deadlines to get bills in. From what I understand, it's a soft deadline. So there are bills that will come in after, but the longer we wait, the harder it will be to get it in there. So all of that is happening now. Our job at the local level is really to get feedback, gain support is what, I would like to see our operators say, yeah, this makes a lot of sense. And yes, I can support a $5 increase type of a I'm hoping that we have a few operators that would be willing to say, yeah, this makes a lot of sense, and happy to do it because the service that they get from the health department and our sanitarians provide them with really high quality information, high quality technical assistance. We do a really good job just building relationships with our operators. So I'm hoping that they see us as a valuable resource to them and see that a fee increase is not, especially the minimal fee increase that's being proposed, is not going to be a hardship to their business. So if Costco fights against us, I'll be really upset.
I was just gonna
The
say,
amount of money I spend in that store.
multi-million, I know, right? Cannot get out of there for under $250. Somehow they
At
have
the
that
very
dialed in.
At the very least. So those are the two announcements. I will follow up the meeting with an email with information about both Invisible Shield as well as the licensed establishment fee discussion that's next week.
Okay. I will now open up the conversation to public comment if we have any.
And Madam Chair, because we didn't take public comment along the way,
yeah.
I recommend that, 'cause I forgot to prompt. I recommend that you do any public comment on items on the agenda or any matters not mentioned.
Okay, yes,
So both.
please.
And I think Laurel was helping. So let's see.
There are no public in the, on the call.
Thank you.
Thanks.
Okay.
Laurel.
With that, the meeting is adjourned. Thank you so much.
Thank you. Thank you.
Happy holidays to everyone.
Happy birthday.
Yeah, thank you. Just getting older, right?
Yes. So we don't meet again in December.
January. What is that date? It will be back to the 4th.
It's January 23rd.
Thank you.